Okay, am I audible properly?
Yes, ma'am.
Yes, ma'am.
Okay. So let's talk, okay? Let's talk about menstruation, feminine hygiene, and related stigmas and the menstrual health, which is very important. So, as far as I know, all of you are school student, right?
Yes, ma'am.
Yes, ma'am.
Okay. Some of you are from West Bengal and some of you are from Uttar Pradesh. Okay. So let's start. Now I have kept few slides, but mostly we will discuss. We'll talk. Okay. So as just now you saw that video, right? Very nice video. Okay. So menstruation, this is a very normal, natural, physiological or biological process. It will happen to all the girls. Okay. At a certain when puberty reaches, it is on an average 11 to 13 years. Okay. So menstruation will happen. But the thing is, we all know that this is a natural, normal and physiological process. But still, so many issues are there. So many stigmas are there. People do not want to talk on menstrual hygiene. There is so much of taboos and myths and misconception. Everybody, especially in the initial stage, during puberty, when menarche or onset of menstruation occur, girls, they feel shy to discuss their menstruation with anybody, even with any girls also, be it her friend or her cousin, sister, anybody. So the thing is, we all know that this is natural and physiological, then we should speak about it. There is nothing to feel embarrassed or shame. Okay. Now the next is when menstruation, we all know that menstruation will happen. So the next important thing is the hygiene, menstrual hygiene management. Now see, we all keep all the body parts, okay, our hands, our body, our eyes, our hair clean, our foot. So this hygiene is so important. The personal hygiene practices are very important because the very most important thing is they prevent you from so many diseases. अगर हम लोग अगर क्लीनलीनेस हाइजीन नहीं मेंटेन करते हैं तो हमें बहुत सारे डिजीज हो सकते हैं. ओके, तो रोग যেটা আমি ওয়েস্ট বেঙ্গল স্টুডেন্টরা সবাই জানে. আর এই কোভিড, after covid we all have come to know that hygiene is such an important thing. Those are from West Bengal, we all know that আমাদের যে পরিষ্কার পরিচ্ছন্নতা যেটা মেনটেন করতে হয় সেটা যদি আমরা না করি অনেক রকমের আমাদের অসুস্থ হয়ে যাব. So we all know. So at the same time we are maintaining hygiene of our hair, our teeth, our body, hands, foot, everything. But then the feminine hygiene, okay, or the intimate hygiene in relation to menstrual hygiene, and also not only during menstruation, not only that during 4-5 days of menstruation, but throughout, always we have to maintain the intimate hygiene. Okay, feminine hygiene is so important. Now I was talking about the diseases. You won't believe that due to improper intimate hygiene, okay, if the menstrual hygiene is not proper or the feminine or intimate hygiene whatever is not proper, so many disease can happen. Infection, reproductive tract infection is one such example. Then a long term, I would say, not acutely, but cervical cancer. I don't know, I think you all must have heard about cervical cancer. Okay, that is a reproductive, just below the uterus, the cervix. You all have read in your biology books the reproductive organs. So just below the uterus it is cervix, then below that it is vagina, the internal part I was talking about, not the external genitalia. So internally. So in Bengali, that jorayur mukh, jorayur mukher, that is cervix. So cancer can happen. Now, for cervical cancer, there are so many risk factors, so many issues are there. But one such is if the intimate hygiene is improper or it is not proper. So, it is very important that if you want to stay healthy, then we have to focus on our menstrual hygiene management and definitely throughout the year, the intimate hygiene. So MHM or menstrual hygiene management, it is a very important thing for adolescent girls and women. Okay. Now, what is important? Important is, do you know whether whether menstrual hygiene is important? First of all, that one has to understand. If I go in a village and I ask a girl regarding menstrual hygiene management, or I ask that what do you do during your menstruation? How do you maintain that hygiene? So it might happen that the very first question she will put on me is, what is the importance? Why we will focus so much on menstrual hygiene? So the very important thing is that people has to understand the importance of menstrual hygiene. Like, we understand the importance of hand hygiene, we understand the importance of hair hygiene, oral hygiene. So at the same time, we have to understand the menstrual hygiene. If we do not understand the importance of menstrual hygiene, then people will not follow, So what are the benefits of following menstrual hygiene? That one has to know. Access to knowledge and information. I have seen many girls, still, even after so many awareness programs are going on this menstrual hygiene, many girls, they do not know properly that actually what to do during menstruation, what not to do during menstruation. They do not know. So access to knowledge and information is the very, very first and important criteria. अगर किसी को पता ही नहीं होगा कि मुझे क्या करना है ड्यूरिंग मेंस्ट्रुएशन, अगर किसी को पता ही नहीं होगा कि मेंस्ट्रुअल हाइजीन कैसे करेंगे, देन वो तो कभी नहीं कर पाएगी. सो दैट इज वेरी इम्पोर्टेंट. आगे जानते হবে, নলেজ ইজ ইম্পর্টেন্ট. জানতে হবে যে আমাকে একে তো আমার মেনস্ট্রুয়াল হাইজিনের কি ইম্পর্টেন্স, সেকেন্ড ইজ কি মেনস্ট্রুয়াল হাইজিন কিভাবে মেনটেন করব, কি কি করতে হবে আমাকে. ঠিক আছে, তো নলেজ ইজ ভেরি ইম্পর্টেন্ট. After knowledge is access to safe menstrual absorbent. Now you all know menstrual absorbent. Now menstrual absorbent in different parts of the country, in rural, urban, semi-urban, wherever you will see, or it it varies among cultural also. Then in different culture there are different and there are different preference of menstrual absorbent. And personal choice is also there. Some people, some girls, they want to use only the commercial sanitary napkins. Some feel that no, some prefer only that cotton reusable. Some in the villages I have seen, they use cloth. Now, access to safe menstrual absorbent. So what I'm trying to say is, safe is very important. Like in that video, you saw that in many places people are using that waste material, any kind of waste material, or any rags, paper, or leaves. So that is not the correct way. Okay, that is not the correct absorbent. Next is water sanitation and hygiene infrastructure, which is very important, be it your home, your school, or even when you will grow up, you will go to work. Okay, in your workplace also this is very important, in your college also, and this is very important. So the infrastructure of toilet, proper privacy, space for changing the sanitary napkin or any menstrual absorbent. Then water facility for washing hand. Then not only water, soap is also important for your washing hand. Then dustbin, a proper dustbin for disposal. So these are the infrastructure. We'll keep on talking in details. Okay, then access to safe disposal of used menstrual absorbent. That is also very important. Only you are using it and you are just throwing it anywhere you feel like, indiscriminately you are throwing it anywhere, like in ponds, okay, nearby water bodies, in road, or anywhere, nearby. So that is not the correct way of disposal of menstrual absorbent, because the safe disposal is very important. First of all, a clean, we have to keep our environment clean. So that is very important. And this commercially a sanitary napkin which are disposable, you must all be knowing that that is not environment friendly, that is not eco friendly. So we have to be very conscious while disposing our menstrual absorbents. So these are the 4 very important points. Now for menstrual hygiene and menstrual health, so some key points on which we will be talking is the hygienic absorbent. Now see, most of you prefer, depends, like I have seen many people prefer the commercial sanitary disposable sanitary napkins. Some of them prefer that cotton pads. Now whatever, the most important thing is the availability. Now if you go to village, okay, maybe you will see that these are not available. The commercial sanitary napkin, it is not like not available, but they have to go far away to any chemist shop or any kind of shop. So it is not very near to their home. So in that case, I have seen they use the cloth. Okay, now see, the cloth is actually, according to menstrual hygiene management, doesn't come in hygienic absorbent. But the thing is, as I said, 2-3 point is very important: availability and economy. Now how many people can buy, that commercial disposable sanitary napkins are a bit expensive, so how many of them can buy? And personal choice is very important. Then the familiar, some cultural, in family, that girl, her mother has told her that, yeah, I have cloths, so you will be using the cloth only. Now the thing is, if somebody is using cloth, there are some very, very important points which needs to be remembered. Although I say that cloth is actually, according to menstrual health, menstrual hygiene management, it doesn't come under a hygienic product. So first of all, I'd say, like, even if somebody is from rural area, I'm just saying, I don't know whether you all are from urban or rural area. If somebody is from rural area, that free days, from government scheme, menstrual hygiene management scheme, so it is very, very, in low cost, the free days product, the sanitary napkin, is been provided from the government to the adolescent girls and women. Now the ASHA workers, the health workers, the frontline health workers, they are supposed to distribute. Now the thing is, if somebody is in a rural area or even in urban area also, some outreach session, health, health center, outreach health session, all these things happen. So one can go to the health worker and they can ask. Those are very, very low cost. So it is not like only that commercial which we see in ad. That is the only option we have for disposable sanitary napkin. But free days, like I said, free days, you can ask them. Now I was just talking about the cloth. The thing is, if somebody is using cloth, now so many things she has to remember. Okay, and if any, in fact, a very minimum, minimum poor management of that hygiene of that particular cloth can bring health hazard and infection. That is why cloth, anything related to plain cloth I'm talking about, is actually considered to be unhygienic. Like it is said, if somebody is using cloth, then clean cloth has to wash very properly, okay, with soap, water, very properly. Then she has to dry that cloth in open, not in a closed room, in open air, where a sunlight, sunlight is very important. So that cloth should be dried under the sun. Then again, that cloth after drying should be kept in a very clean and dry place. So you can understand that it is a bit difficult process, but still I'm telling you, after all, there are many people, for whom this is the only option. They choose this only, and by any way, this is the only option for them. then they have to use that cloth in this way, which I told. Apart from that, the commercially sanitary disposable napkins, and another is which is available but very few. I have seen, it is not that popular, is cotton, the commercial cotton reusable pads. So that cotton reusable, now see, that is reusable. Again, when it comes that it is reusable, then again you have to keep in mind that when after first use and the second use, so you have to keep that pad in a very hygienic condition, the cleaning and everything, and as I said, in a cold sunlight only, the proper washing, sunlight, keeping in clean and very dry environment. But which is disposable, one time use, for that is the packet one. So that is just one time use, you will use and you will just dispose it. So that is not environment friendly. But the thing is that cleaning and that cleaning which I was discussing, that part is actually not required in the disposable, because you are using and you are just disposing it. ঠিক আছে? So hygienic absorbent, what and yeah, very important, one thing is very important. Most of the time what happens, that sometimes skin allergy occurs due to that commercial disposable sanitary napkin. So if allergy occurs, then you should definitely go to some doctor, because now without inspection, what kind of allergy is that you have to understand. According to that, some medication is required. And it might happen that you will be asked that for upcoming few menstrual cycle, do not use that commercial sanitary, that disposable napkin, use the cotton one. So that depends. Okay, so then the barriers, as barriers in that video you saw, that the barrier is the not availability of a proper place to change the that sanitary napkin, or to wash the intimate area, okay, that vaginal area. So in school, a proper toilet, a separate girls toilet is required. Then the thing is that proper water facility, soap facility, and dustbin, a separate dustbin for this absorbent, for this sanitary napkin. That is very important. In fact, in school, a vendor, sanitary vendor, we say that should in all schools should be there, because accessibility is also very important. If a girl has gone to school in morning and just after 4 or 5 hours, menstruation has occurred, then what she will do? Okay, then she has to ask for the sanitary napkin from the school. So in school, I don't know in how many school it is there, but ideally it should be there, the vending machine. Okay, the vending machine of sanitary napkin should be there. Intimate hygiene, I was just talking about, it is not only during menstruation but for the entire, always, for the everyday. Intimate hygiene, now see, during menstruation, some kind of myths are there that you shouldn't take bath. That is totally wrong. Okay, that is totally wrong. Bath should not be avoided. Okay, bath should be you should always take bath. Menstruation is not something that for that you will not take bath. Bathing, a clean cloth, a clean dress, everything that is separate, everything should be clean. Now keeping the intimate area clean, or the vaginal, external genitalia, the vaginal and vulvar area should be kept clean. Now the very most important thing is, you should not use harsh soap, soap, sabun. So our vaginal region, the pH balance is very important from 3.8 to 4.5. If there is pH, so from 3.8 to 4.5 means slightly acidic environment is required. Now if some kind of soap, we do not know, there are so many soap in the market. If you use any soap, you do not know what is the pH level, the pH value of that soap. If it is too high, and if you are going to use that soap around that intimate area for washing, that is actually a very bad practice. You shouldn't do, because what will happen, your normal healthy pH of vagina will get disrupted, because that soap has very high pH and your vagina needs 3.8 to 4.5 low pH. So if a high pH soap is used, then what will happen, there is a very high chance that infection can occur. Okay, vaginal infection or any reproductive tract infection can occur. So now I just said harsh soap. Harsh means a very harsh kind of which seems that it is the pH is very high. But the thing is, it is very difficult to understand that what is the actual pH of any soap. So it is advisable that you shouldn't use, because you do not know it properly. The thing is that you do not know it properly. If you know that yes, the pH of that soap is within 4.5, then it is okay. But the problem is, we do not know. It is not possible to know the pH of all the soap. Now generally, now in the market you will see some intimate wash, like so many brands are there. One is V Wash, you all know, you have seen in TV also. So that is clinically tested.
Okay, ma'am.
Any intimate wash material, any intimate, which is clinically tested and safe, okay, FDA approved, can be used. So if one cannot access, okay, a proper intimate wash material, or there is also an issue of money. If somebody cannot afford, I'm just talking in general, okay, in generalized I'm talking about, then the proper way of maintaining intimate hygiene is to wash the intimate area with lukewarm water. Okay, lukewarm matlab not very hot water or not very cool water. हाँ, बहुत ज्यादा गर्म नहीं, बहुत ज्यादा ठंडा भी नहीं, एक जो हल्का सा गर्म पानी जो होता है, हल्का गर्म जल. Okay, so that can be used. Now during menstruation, so 2 times definitely, because you will be, it is said that it is always advisable to change the absorbent, okay, every 4 to 6 hours, on an average 4 to 6 hours. So if somebody is changing thrice, then thrice she should wash that genital area, the vaginal and the vulvar area, with lukewarm water. So that is very important during menstruation. And apart from during menstrual days, the normal, other days actually, not normal, other days. So in that day, at least once, like during bath, during bath, everybody, all the girls, they should use that lukewarm water, and they should wash that intimate area very properly. If she cannot access, or she is not using any kind of clinically tested a proper that intimate wash material, then lukewarm water is good, is enough. Okay, so that is very important. And as this is a very bad practice that once a girl is using for the entire day. No, because this is a very bad practice, and the thing is this will lead to infection. Okay, so these are the things. And one more important thing is, like, if any time, if you see that any soreness or pain or any swelling, if you see in your vaginal area or the adjacent external genitalia area, so do not feel shy. Okay, talk to your mother, talk to your sister or any family member and go to a doctor, because that kind of that swelling or any kind of the rashes uh, can be maybe due to some infections, or basically the thing is what you have to keep in mind is that any kind of symptom matlab any pain, okay, in fact during micturition, during urination, if you see that painful urination, during micturition and during urination, if you feel pain, okay, then it is very important that to consult a doctor. Urinary tract infection can happen, or in fact adjacent area, if there is any abscess or boil or any kind of swelling, any kind of infection, then you should always go to a doctor. Regarding safe disposal, we'll talk later. Let us talk about diet and exercise. Okay, now diet and exercise. So nowadays, junk food, it has become so important. Many of you who are sitting now, you all like most of the time you are taking junk food, outside food, too many spicy and oily food. So anyway, it is advisable to avoid junk food. Okay, maintaining body weight is very important. Okay, maintaining body weight is very important for the general health, and also for any reproductive, like if somebody is obese, then some reproductive problems, some PCOD, like polycystic ovarian syndrome, ovarian disease, it is related to obesity. So weight management is very important. Now during menstruation, or I would say like always also, because it is not always important that only that 4-5 days you are maintaining your diet properly. Actually, how you are maintaining your diet always is also important, because premenstrual symptom, you will see during menstruation mood swings happen, okay, some irritation, or you will see a headache, heaviness in the head. So these things happen during menstruation. So the thing is, diet has a very important role in prevention of premenstrual symptoms. Premenstrual means, see, just before the menstruation, and during menstruation also you will see a dehydration headache occurs. Some kind of headache you will see during menstruation on the first 2 days. Then a fatigue, muscle fatigue in your leg, okay, in your thigh muscles fatigue is, you will see most of the girls, they feel there is a fatigue, muscle fatigue during menstruation. So diet is very important. What are you eating is very important. So in diet, the very most important thing is water, fluid, plenty of fluid. So this is very important. Fluid is very important. And I was just talking about that dehydration headache, during menstruation, dehydration headache occurs because fluid, you are losing fluid through blood. So water, you have to drink plenty of water. Okay. So at least that the average size glass, the entire day, average 5 to 6 glasses, definitely you should drink. Then fruits, juicy fruit, watery fruits like watermelon and cucumber. So these are juicy fruits that you should take during menstruation or any day. Definitely during menstruation also. Then fish is very important, Actually, see, any iron containing food, the most important is iron containing food or protein containing food, magnesium containing food is important for your maintenance of menstrual health. Now, I was talking about the fruits, fruit juice, then vegetables, green leafy vegetables, green leafy vegetables, spinach. Spinach has a very high content of magnesium, also iron, but most of the time we miss magnesium. But magnesium is very important because it is said that magnesium helps in prevention of premenstrual symptom also. Fish, and those who are non-veg, okay. So those who are non-vegetarian, fish is a very important source of iron, then protein, so it's a very important source. Then chicken, okay. what you have to remember, you always have to avoid very oily and spicy food. During menstruation, definitely you have to avoid, because you will see that during menstruation, abdomen, upset, gastrointestinal problems happen. Nausea, a vomiting kind of tendency, then bloating. Bloating means a very uncomfortable state of stomach. It seems that air has been accumulated inside the stomach. So these things happens during menstruation. So very oily and spicy food you have to avoid. That is very important. Okay. Then coffee. Coffee also one should avoid. Coffee is, coffee is not good. So coffee is not good in the sense, I'm not saying that you will never take coffee, okay. At least during menstruation, you shouldn't take coffee. Or sometimes you can take. But anyway, in any other days also, you shouldn't consume too much of coffee because it contains caffeine. So it is not good. So these vegetables, fruits, these are very important. Any iron containing food I told that you have to keep in mind, and fruit juice. And you should, you should always try. Now, fluid doesn't mean that you will be having so many cold drinks, so much of cold drinks. Okay, so not cold drinks. Fruit juice, you can prepare fruit juice in your home, okay, or you can, better always that you should eat fruit directly, okay. So always eat the fruit directly. Then dry fruit is also important. Nuts, nuts and dry fruits, that also you should take. Okay, then exercise, though, why only menstrual health? For your overall health, exercise is important, okay. So every day one should do exercise. So I don't know how many of you do exercise or any kind of physical activity. Here I have written exercise, but any kind of physical activity. Now see, freehand exercise you should do always. Every day you should do in the morning. Skipping, running, jogging, swimming, okay. Yoga, if somebody is interested in, somebody knows, then she can do yoga also. So exercise is important. Cycling, okay. Like if you are going to your school by cycling, that is very good. Skipping you should do. Running, you should play in your school, okay, after the school or in your school. So sports, physical activity, exercise is important. So these are the things that you have to keep in mind. Now see, disposal mean, like I was talking about observant and everything. Now the thing is, in in urban area, okay. So municipal waste management, municipal, from municipal area, a person comes and he takes, he collects all the waste and garbage from the residential area, from your home. So if under any municipal area there is some rules and regulation that disposal should be like this or it should be like that, then that should be followed. Not should, that must be followed, okay. And if there is no such, written or something, if there is no such, if some municipality has not mentioned any strict measure of disposal of menstrual waste, then actually whoever comes, whoever comes to collect, he should be informed that this is a menstrual waste, because all the waste, they collect together from residential area and they go and treatment, the waste treatment is done. So it is always advisable and it is always better that the disposable, the person who collects waste, he should be informed that this is the menstrual waste. You should not use plastic, use paper. Use paper for wrapping the menstrual absorbent. So in your home, in school, I will say later, in your home, you have to throw in the dustbin, and every day that, that municipal boy, he comes and collects the garbage. So then you have to dispose to that, to that municipal boy who collects. And you have to say that this is a menstrual waste. Now, sometimes it happens that he will tell you that from next time, please give it in that way or in some other way. He might tell you that given this that way. So I mean, double, just wrap in double paper. Okay, not in a single paper, wrap in a double paper, whatever he said, but that you have to follow. So, whatever he said, that you have to follow, because he's the one who is going to collect, then after segregation will happen, then treatment, so it is important. Now, do not throw that menstrual waste anywhere, like in the, in the sanitary latrine, in the flush. You do not flush, okay, because blockage of drain can occur. Do not throw in your nearby any open drain or in pond or water bodies. Or you see, I mean, in most of the area you will see that there is a garbage heap. Do not throw. Okay, you should, in under municipal area, always one should remember what is the rules and regulation of that particular municipal body. So that has to follow. I mean, do not throw it anyway indiscriminately. That is very important. Okay. Then just do not open, just keep it and burn it in open space. Do not do that. That is not at all advisable. Just do not burn it. Okay. Now, the thing which is, which is reusable cotton and that is eco-friendly, that absorbent in most of the place it is done. And what can be done, a deep pit, a very deep, it can be made, a deep pit can be made, and the disposal of that, because that is environment friendly. If it is environment friendly, then you can dispose it there. See, the thing is, it depends where are you staying, what are the environment situation, what type of product you are using. These things are very important. Now, incinerator, if incinerator is in any like in a large complex of large complex of residential area, a safe incinerator is there. So that one has to know, or if somebody is there who can who can just treat that menstrual waste in that incinerator, then it is okay. So it depends where are you staying, what are the situation. Otherwise, basically what happens in waste treatment plant, through incinerator, that menstrual waste is basically treated. Okay. Now, nowadays so many actually so many a kind of experiment, and they're developing prototype of smokeless incinerators, so that it can be used in any residential area. So that will be smokeless. Ashes, the waste after burning, ashes will be less. So these things are going on, but let's see when actually this type of incinerator is going to be available and how much everybody can get access of it. So that is important. So the important thing is in your school also. In school, in most of the school, I have seen, I have read that there is a special incinerator. So according to school guideline, in a school, if there is an incinerator, or even if there is not any incinerator, then there is a guideline for menstrual waste management. So that is very important, that you have to follow that. The same, you have to see that whether to you have to wrap it properly in the paper, and you have to throw in the dustbin. So school also, they have to provide all this infrastructure. That is very important. Next thing is the stigma or the taboos. So, although day by day, during the last 10 years, before 10 years and now, still the condition has improved, in the sense, like previously, so many stigmas were there, so many myths were there, but now, due to awareness and knowledge dissemination, these things have come down. So see what I have written: stigmatizing adolescent girls and women through misguided beliefs and age-old cultural practices contributes to gender inequity and undermines basic right. So, so many older cultural practices there. In some family, you will see that if you are suffering from, if you have menstruation, you will not go outside, you will not take bath, you will not worship, you will not go to any temple. Basically, these are all the, misconception, misguided belief. These things had got no connection with menstruation. Now, what happens in a family? There is a boy and there is a girl. A family is allowing that boy to go outside, you go there or you go to temple or do whatever. But to that girl, that family during menstruation is not allowing. So what is happening? There is a gender inequality. Okay, because that girl, she also has the right to go outside. Okay, she also wants to go to temple or any places. So she has been, restricted. So many restrictions are there in many families. So these are basically this stigma, and this myths, has got no connection with this menstruation. Or if you're having menstruation, do not touch this or do not touch that. No, the thing is, you have to remember, you have to keep your hands clean. That is important. You are menstruating, that doesn't mean that you are dirty. No, you are dirty. This is basically a very bad concept. Okay, this is basically a stigma, you can say. So the only thing is that you have to follow all the menstrual hygiene management process. Whatever I was discussing till now, that is very important. Now see, being a girl, okay, now it is not always that only girls should know or boys shouldn't know. Why not? Boys should also know. Okay, it is not like if you are going to school, okay, and if you see some boys, they, sometimes it happens, if a girl has got red stained, stained in her school dress, there are some boys who are just making fun of her. Okay, so these things shouldn't be there. Okay, because what will happen, then that girl from next time, she will not go to school. Or she might feel that, okay, no, those boys were just laughing at me, this kind of shy, these things, these things shouldn't be there. So our boys and male members, they should also be involved, and they should also be make aware of all the menstrual hygiene issues. Okay, and then in school, teachers, like, in some school, like not in some school, in fact, in outside school also, in school also, the peer-to-peer interactions happen. Like you will be talking to your another friend, she will be talking to and then another girl. So this peer-to-peer, interaction is also important regarding menstrual hygiene. So girls hygiene club, I mean, see, you all are student, you all are young, and you are very active. So what you can do, today I have talked about so many things. I have made you aware of so many menstrual hygiene management and menstrual hygiene issues. Now what you can do, you can be a leader, peer leader, you can make a group, you can create awareness among your schoolmates, among your family members, you can make aware. Okay, that is why, in school, girl hygiene clubs can be made. So in that club, you can discuss regarding menstruation. You can talk to your teacher, not only female teacher. You can also talk to your male teacher. Teachers have a very important role, okay, in this menstrual hygiene management. So being a class leader or class monitor or a hygiene club leader, okay, any kind of, you all should come forward. You all should come forward. You should ask your school authority to have a proper toilet, to have a proper hand washing facilities, to have a proper sanitary napkin disposal facilities. So these are the things you should take initiative. Okay, so I was discussing so many things. Now we will interact. I'll ask you to, if you have any queries, you can ask, or you can share your experience. Okay, you can share your experience. Any kind of story you can share, that this happened, then I did this. Anything you can share here. Okay, and here you can see thank you. You can see the two picture. Let's talk periods. So there's nothing to feel shy or embarrassed. You should talk about the periods. And end menstruation stigma. This stigma should be ended. So you are the future of the country. I always say the adolescent, the students, school students, they are the future of the country. If they want, they can bring any positive change to the society. They can bring any positive change to the nation. So come forward in your school, in your home, in your anywhere. Come forward, discuss, okay, and do not. If your mother or your grandmother is saying you feel that some superstitious belief is there regarding menstruation, then you try to make her understand politely that no, menstruation is a biological or normal physiological process. It has got no relation with bathing or with the temple or with the worship. Until unless if you are comfortable, the thing is you should be mentally comfortable. That okay, there should be no restriction. Yeah, if a girl is not comfortable, then it is okay. If she's not comfortable in going to temple during periods, that depends on her. But if somebody wants to go outside or do any kind of activity, okay, then there shouldn't be any restriction. It all depends how much she is comfortable during her menstruation and how what actually she wants to do. Do not, there's so many girls that do not go to school. School absentees. Menstruation has become a very important reason for school absenteeism. They do not go to school during menstruation because there is no proper facility in school. Okay, so many issues is there. And for cramps, menstrual cramp, like whatever diet and exercise I was talking about, if you follow that diet and exercise properly, then you will see there will be very less cramps. Okay, even if you see that during menstruation you are feeling menstrual cramp, then hot water bag you can use, hot compress. But one thing you have to remember, if you see that there is huge menstrual pain, huge or heavy bleeding, or 8 days, 9 days, if there is menstruation, then definitely you should go to a doctor. That means some kind of problem or some pathological problem is there. So that you have to keep in mind. So do not, feel shy to discuss with anybody. Okay, come forward, be an active leader and spread awareness. Okay.